Evening, good afternoon, and good morning. This is the 1565th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Gurukiran from Karnataka. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, and the second session is in English. That is the international session from 8:30 to 9:30, and from we have a local language session from 9:30 to 10:30 in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that you can subscribe the same without paying any penny, and those who miss the session can also watch it, and you can share it with your friends so that it will reach every house in and around the world. Thank you all. Let us begin the session, and let me introduce today's guest. As you know, it is Dr. N. Gurukiran. He has completed BHMS and is a SCPH holder, and is a passionate classical homeopathy practitioner practicing in the district of Chadamangalore in the state of Karnataka. He has more than 15 years of clinical experience. He has completed BHMS from Government Homeopathic Medical College Hospital, Bangalore, affiliated to Rajiv Gandhi University of Health and Science. He is an independent researcher. He has completed SCPH, special post-graduation fellowship in SCPH, and has presented various papers in homeopathic approach for the treatment of different type of these cases, especially psoriasis, thyroid disorders, PCOD, epilepsy, hypertension, respiratory disorders, GERD, alopecia, erecta, infertility, etc. He is a regular presenter in one of the presenters who has made more presentation in this forum, and today he will be talking about homeopathic manifestation in challenging cases. This is something great, because always we get those cases which are supposed to be incurable, and homeopathy can do wonders in that way. Let us proudly welcome the guest of the day, Dr. Gurukiran, to this session. We proudly welcome you, Doctor.
Yes, sir. Thank you.
1 minute, 1 minute. Please unmute, please unmute.
Can you hear me, sir? No?
Yes, yes, yes.
Okay, sir. Thank you very much for the warm welcome. And good evening and good morning to some part of the world for the today's session. Yes, and today's topic is the homeopathic manifestations in challenging cases. What does it mean, challenging cases? It means that a lot of cases in day-to-day practice, we encounter a lot of cases that will challenge us for the treatment of homeopathy. So what is the manifestations of homeopathy to those challenging cases? Let's move on to the first and foremost. Before proceeding further, tribute to the master, to Dr. Samuel Hahnemann. And I would like to dedicate this session to my mother. What are the objectives for the today's session? The objectives for the today's session is to know about the challenging cases and approach towards those cases and the treatment part. So how can we treat those challenging cases? So these are the main objectives for the today's session. So first, management of acutes as a homeopathic perspective. So we all encounter acute cases daily in our practice. So what is the management of it? First and foremost, I would like to present this case. A female aged about 60 years was presented with a severe chest pain with anxiety, and the pain radiated to back. This was a presenting symptom. Instantly, the BP was measured in my clinic. It was around 220 by 110 mm of mercury. Pulse was very rapid and bounding. It was 110 per minute. Definitely, as any physicians does, I have sent the patient for ECG and the cardiac markers. What can we expect? What can we suspect after presenting this kind of a symptom in our clinic? This is her ECG report. It shows that ECG is sinus rhythm with high voltage. So you can see the high voltage, V4, V6. This is the report. Sinus rhythm with high voltage in the left ventricle. So now, what is the role of a homeopathic physician in this case? The patient came back to me and she was inquired for the cause. And when I probed the case, the patient narrated for quarrel with her son for the money and property. There was some dispute. From this incident, the patient started to tell, I doesn't want to live. So what can be done now as a homeopath? We got something in the case. We got an entry point. On the basis of this symptom, medicine was prescribed and asked her to visit tomorrow. So what does it shows? What can we do as a homeopathic physician? We have to go for the repertorial chart. Let's see what shows in the repertory. In the repertory, there is a rubric called as despair, doesn't want to live. See exactly what the rubric says. What is the remedy which is coming out? It is aurum. Yes. So one dose of aurum at 200 was prescribed and another dose was given to her. If there is any aggravation, she can take. The next day morning, she came back to the OPD. The patient was better without any kind of anxiety. The BP was 160 by 90. The pulse was 90 per minute. Chest pain was reduced. There was no chest pain. So again, she was continuing with the SL. After a week, she came back again for the checkup. The BP was 150, 70 mm of Hg. Pulse was 80 per minute. So in this case, being a physician, we should not get panic in this kind of cases by not to referring this kind of cases. So we have the potential, the repertory have the potential. So we have to address the case properly and enter the case with a proper rubric so that we can get good results. Yes, another case of acute appendicitis. We all know this appendicitis. A female aged 50 years was presented with the symptoms of pain in the right iliac fossa of the abdomen and tenderness in the McBurney's point. The patient was diagnosed with acute appendicitis and confirmed with ultrasound scan. And the patient was advised surgery for the condition. The patient was not interested to go for the surgery. Then they came to me and asking, is there anything can be done with the homeopathic treatment? So what could be the answer from the homeopathic physicians? Can we treat these kind of cases, acute appendicitis, or shall we refer it to the surgery? So what is the potential of homeopathy in these kind of cases? Can we take up this case or shall we send it for the surgery? This was the situation. The patient clearly asked, is there any scope? Is anything can be done in these kind of conditions? We should be cautious and we should be very clear before taking up these kind of cases. This is the ultrasound report. It clearly suggests of acute appendicitis. So, after that, on further inquiry, the abdomen pain was aggravated to any movement. The patient was thirsty and constipated. According to the acute totality, patient was prescribed. After that, within a day, the patient got better with no abdomen pain. The patient passed a bowel in the next morning. So, what may be the prescription? Let us see in the repertory. Appendicitis, aggravation movement, thirsty, constipated. Make it a totality. Search it in repertory. Now, you can see the result. So, the remedy prescribed was Brania, Alba, 200, 4 doses, 4 packets, which I have given to her. Because if there is an aggravation, the patient has to take at that time. Cautiously have given that. The patient was better by the next day after the prescription of Brania, and she passed the stools. And patient was advised to continue the medicines for 3 days. After 3 days, the patient came back absolutely fine. And the patient was advised another ultrasound scan to see the progress. Because we have to see what has happened. If the patient says that I am better, but if there is any still underlying pathology still present, then we should be very careful. So on the basis of that, I have advised another scan. See the report just a week after that. The report says no abnormality detected. So can we treat appendicitis, acute appendicitis cases? Yes, definitely we can treat. The key here is to take the totality, enter with the correct rubrics, make repertorization, and prescribe the medicine. And I would like to present a few cases approach to the fevers. Nowadays, fever are very common and we encounter daily lot of cases. So what does the say about the fevers, approach to the fevers? Upon the homeopathic principle, we have to treat it with drugs capable of producing fever. Acute totality with characteristic symptom as an entry point. In chronic fever cases, we have to go for constitutional approach. For fever in general, in repertory, we have got around 1097 remedies. So we have to prescribe only one remedy according to the totality. So make it acute totality and enter with the characteristic symptom if it is present in the case. make it as an entry point. So this should be the approach to the fevers. A female aged about 58 years was presented with the fever since 3 months. She was admitted to hospital in month of January for the sake of fever. She has undergone a number of investigations, which includes HRCT 3 times. It's a post-COVID case of fever with chills. Past history. There is a history of hypothyroid since 6 years. Got to know autoimmune thyroid since August 2020. History of varicose veins, both the legs, since 15 years. History of miscarriage twice. And there is dust allergy with eye irritation, which aggravates in winter season. And according to the first prescription, she was given Brania 200 and Alsar 200 with no result. The fever continued and it was constant. After 3 to 4 days of this prescription, one fine morning, the patient daughter called me and said, "Sir, there is no change in the fever. The fever is constant. At any time you see, there is fever in her. Midnight, morning, evening, afternoon, at any time. Fever is constant. There is no change. So, I have to break this cycle of fever. So, what can be done? We have to prescribe the medicine that fever has to reduce first, so that the patients and their guardians get confidence in homeopathy. So again, what can be done in this case? Yes, have to go for repertory. There is a rubric called as fever constant change of pyrogenum and restox. So I prescribed a pyrogen 200 single dose. Fever reduced within 4 hours time. Patient got better. After 24 hours, fever again started. So what the pyrogen did was, the cycle was broken. The fever was constant. So that the cycle was broken by the pyrogenum 200. Then after 24 hours, the fever again started. So what can be done now? Again, they called me back. They said, "Sir, fever again started." So now the case was somewhat clear. Now make it a totality. The chills before fever. She used to feel very chilly before starting of the fever. There is weakness, fever during, thirsty fever during, especially fever started in the afternoon, and desires for salty food during fever. So this was the clear totality which was taken from the patient. Now what happens? See in the repertory. Fever with chill, fever weakness, thirsty, fever in the afternoon, desire for salty food. So what is the remedy now? Which is coming out? Natrum. So I prescribed Natrum 200 4 hourly. After 1 dose of Natrum, fever started to reduce well. And the appetite increased, weakness reduced. Is this a bad sign or the good sign? After the prescription, the appetite, hunger increased, weakness has reduced. Is it a bad sign or a good sign? Being a homeopathic physician, yes, it is a very good sign. The generals physical generals especially should get better after our prescription than the particulars, especially in acute kind of cases. So according to this, appetite increased, weakness has reduced. It's a very good sign. For 10 to 12 days, the patient was absolutely fine. There was no fever. After 12 days, she again started with the fever in the afternoon. Again, the fever came back. And I have repeated same dosage, Natramur 200, Natramur 1 m, 10 m. But again, there was no change after 12 days. For 12 days, the patient was very much fine. She was happy. The guardians were happy. Again, after 12th day, fever again started. So what can be done now? Is there anything missing in the case? So after hearing this, again, detailed case taking was done. There was a desire for sweets, pickles, salty things again. There is aversion to onion and garlic. Patient is chilly. So what Natramur has done at that time, it was absolutely fine. Basically, the Natramur patients are hot. In the acute totality, for the acute thing, according to the repertorization, the indicated remedy was Natramur. It has worked well. Now, the fever has been started since 3 months. Now, again, the fever is recurring. Now, the approach has to be changed. What can be done now? Definitely, the approach has to be changed. What next? We took in mental symptoms in detail. The patient is basically introverted in nature. Brooding was present. Broods over past incidences. She was oversensitive, sympathetic in nature, weeps easily but suppresses the weeping. Suppressed emotions. Grief was present, 3+. And in childhood history also, suppressed emotions in childhood due to fear of her father. Lot of suppressed emotions there. Grief was present. So on the basis of that, again, repertory. See the repertory, beauty of repertory there. In the fever repertory, there is grief, bad effects of. There is a long-standing grief in the case. Grief, bad effects of. So what is the remedy? Ignitia. See there, we have touched the superficial part of it by prescribing Natramur. Now it is showing Ignitia. So Natramur, Ignitia are complementary remedies. See the relationship of the remedies. It's so beautifully it has written. So after saying this, Ignitia 200 4-hourly was prescribed. After Ignitia, fever reduced. She was much better. After a few days, the Ignitia 200 TID was prescribed from 4-hourly to TID. Again, there was a slight raise of temperature, only just to 99 degrees Fahrenheit, not beyond that. The patient was asked to take Ignitia 1 m 4-hourly. After that, the fever disappeared without any recurrence. The patient was so happy. There was no fever after that. She was admitted to hospital where she has given lot of treatments and they have started with the steroids. When the fever was not responding, so they have prescribed steroids. And patient basically she owns a pharmacy, so she knows about the medicines, the drugs, what they have prescribing. She was very much anxious about the steroids. She was not able to take those medicines. Then she came to the homeopath. After these kind of things, what we have inquired, what we have entered, what we have collected, the totality of symptoms. On the basis of that, we have prescribed natramure, then which was complementary to ignitia. Ignitia cured the case beautifully. So this is a approach to the fevers. Next, we move on to the next case, which is a case of liver hemangioma. I think somebody has been treated these kind of cases, I think, liver hemangioma. What is liver hemangioma? A liver hemangioma is a non-cancerous mass lesion made up of multiple dilated venous channels. It is a spongy swelling, also called as cavernous hemangioma. Liver hemangiomas are estimated to occur in 20% of the population. It is usually present since birth. It does not show any tendency to involution. Bluish in color as the content is venous blood, non-pulsatile. So this should be known for the liver hemangiomas. This picture shows the cut section of the liver having hemangioma. Causes may be congenital. Liver hemangioma occurs as a single abnormal collection of blood vessels. It may occur in multiple. May also occur in multiple, but can be also single. See the case now. A female aged about 62 years was presented with a pain in the right upper quadrant of the abdomen since 6 months with constipation too. A known case of liver hemangioma since 9 years. The patient was suffering with burning pain in the right upper quadrant of the abdomen on and off since 9 years, not continuous. On and off, she used to have this burning sensation. The other team of doctors advised for surgery if the problem persists. So now, what can be done as homeopathic physicians? See, this is the report of 9 years before. It shows hemangioma. Nine years before report. And this again, before starting the treatment, I have sent her for the scan again to see whether it is there or not. It is there. It was there. Small hemangiomas in the liver. Few small hemangiomas noted, largest measuring 14 into 11 mm in the right lobe. So this was the report. The hemangioma was still present before I take up the case. Now, after taking the case, repertory has done repertorization. See, there is hemangioma, the pain, burning, smarting, constipation, and the indurations. So what is the remedy there? Carbo animalis. So I have given carbo animalis 30 single dose daily for 1 month. The patient used to visit irregularly actually When there was a pain in the abdomen, the patient used to come for the treatment. In further follow-up, the patient was free from the pain and constipation after prescribing carbonimalis. The patient was advised for ultrasound of abdomen and pelvis. See, after the treatment, liver is normal in size and shows normal aqueous texture, no focal mass lesion. Intra and extrahepatic biliary radicals are normal. Portal vein and CBD are normal. So no sonographic abnormality detected in this case. So this is the beauty and potential of homeopathic, right homeopathic treatment, which has to be entered properly, correctly by using correct rubrics, correct repertorization. Then we can follow with the results. As usual, we encounter this lot of cases today. Case of PCOS. A young female aged about 20 years was presented with the pimples on the face since 3 years. And the patient has been treated for pimples by various dermatologists with lot of ointments, creams and soaps without diagnosing the actual cause. First of all, patient came for the treatment of pimples. Sir, I'm having pimples since 3 years, lot of pimples over the face, and have applied lot of ointments, lot of creams, lot of soaps without any result. And I suspected PCOD in this case, and have advised for ultrasound for the further confirmation. The patient came with this report showing polycystic ovarian disease. After detailed case taking, according to homeopathic perspective, the patient's bowels were irregular, sweating was profuse on palms and soles, sleep was disturbed, and thermally patient is chilly. The weight was 70.4 before the treatment started. Mentally, the patient is introverted in nature, moody, reserved, yielding, angered easily, likes traveling. So this was the mental totality. So now we go for the repertory. Introverted in nature, reserved, the patient is yielding, sweat, palms, sweat, soles, all this, which covers silicea. So the prescription was silicea 200, 2 doses, that is weekly 1 dose for 15 days. Then after 5 months of treatment, the patient body weight came down to 61.3 kgs. It was 70 kgs, now 61. She has lost 9 kgs without doing any other lifestyle changes. And pimples disappeared on the face without leaving any mark. So now what can be done? I have advised for another scan to see the progress. After 5 months, the report says no sonographic abnormality detected. So this is the potential of homeopathy in challenging cases. If the case challenges, then we have to be sure enough or clear enough to take those, convert it into rubrics, go into the repertory, make repertorization, prescribe the medicines. The result is in front of us. Next, move on to the case which is called as Gilbert syndrome. Gilbert syndrome is the common form of congenital non-hemolytic hyperbilirubinemia in which liver doesn't properly process the bilirubin. If you have Gilbert syndrome, you have born with it or it inherited gene mutation. A male aged about 55 years was presented with the symptoms of yellowish urine, loss of appetite, being lethargic, mild yellowish discoloration of the eyes, and mucous membranes since 2 years. The patient was presented with the reports of LFT, which used to be elevated after a number of treatments since 2 years. The patient wasn't free from the symptoms. This was the report. SGOT is raised, SGPT is raised, alkaline phosphatase. After seeing this, case was probed. The mental symptoms was the patient was sympathetic in nature and the patient cannot tolerate injustice. The patient was very religious. This was the mental symptoms of the patient. We go for repertorization. Sympathetic, injustice cannot tolerate, very religious in nature, and have started with the constitution medicine, that is causticum. Causticum honey. So causticum 30 was prescribed because the pathological case, causticum 30, weekly 1 dose, 4 doses in a month. After a month, yellowish urine disappeared, the appetite became normal. The patient started to do his routine work with activeness. The patient got back his interest in household activities and he was on PL or SL for a month. Now, after 15 days, he again complained of decrease in appetite. The patient was again prescribed causticum, 202 doses for 15 days. After causticum 200, the appetite became normal. See the report. Before 2 years, whenever he go for the investigations, the patient goes for the investigation, the report was the same. Now, see, the SGPT has reduced well. SGPT, SGOT, alkaline phosphatase, everything has reduced well. Direct bilirubin 0.0. Only the total bilirubin is slightly higher. Then it will reduce definitely. See, the date 4/12/17 was, yeah, okay, this was the case. This was the case of your causticum case. The patient is happy now. The patient is doing well. Next, move on to the case. Very interesting case. It has the case has been taken in 2017. A 7-year young boy presented with the symptoms of recurrent seizures since 2 years. He was presented with the symptoms of falling down with unconsciousness and jerking of the limbs. This was the presentation. The patient was under allopathic medications. After he started with the treatment, the memory was impaired. There was involuntary drooling of the saliva from the mouth, weakness of the left hand, and excess of sleepiness, due to which the boy stopped going to school. After taking those medicines, the patient was having these kind of symptoms. The 7-year-old boy stopped going to school. So what can be done? Convulsions were still present once in a month. Past history. There is history of LSCS due to improper position in the womb. Family history. No history of major illness in the family. Milestones appear to be as per the age. No abnormalities detected. Diet is mixed. Appetite, hunger is good. Desires and aversions not specific. The boy was thirsty. Bowels and bladder were regular. Thermally, the patient is hot. So this was the case. What can be done in this case? Mentally, the patient is very conscientious and diligent, highly restless boy, very impatient, cannot sit in one place in the school, loves music. He wants the things when he demands. Put his shirt's collar in the mouth. He dances to music when he hears it. Wherever he hears the music, he would like to dance. This is the mental makeup of the patient. Very, very, very restless. The teachers used to complain in the school that this boy will not sit in one place. He'll be roaming here and now. So now, this is the report. The CT scan. Normal plain CT scan of the brain. There was no abnormality detected in the CT scan. So, according to Dr. Profil Vijaykar's chart of suppression, this is in 6th layer, central nervous system, sympathetic nervous system, neural plate. So analysis. So how can we analyze this case? Again, the repertory. The restlessness was key. Mentally restless, nervous, and music causes patient to dance, convulsions. These are the main rubrics which I have entered. What is the remedy indicated is tarantula. This tarantula hispanica. So tarantula hispanica 200 single dose was given. Followed by SL for 1 month. After a month, the boy became very active. The drooling of the saliva stopped. The boy showed interest to going back to school. Is this a good sign or the bad sign? Definitely it's a good sign. The patient showed interest for the school. This was stopped before. The weakness has gone. The patient become active. The drooling of the saliva from the mouth has stopped. All this has experienced by the patient. And one more dose of tarantula hispanica 200 was repeated. After this, after 2 months, the boy was a lot more better. Only one episode of convulsion, and that was very less in intensity. All other medicines were stopped. All allopathic medications was stopped during the course of homeopathic treatment. Again, due to the one episode of convulsion, again one dose of tarantula hispanica was repeated. According to the progress, the allopathic medications was gradually tapered and stopped at one time. After 6 months, there was no single episode of convulsions. till date, almost it's been 17, almost 7 years, there is no single episode. It was 4 years actually what I have written there. Now it is 7 years, there is no single episode of convulsions till date. I know the family very well. I know the parents very well. So from the today's session, we got to know how to handle these challenging cases. How can it be handled confidently through homeopathic medicines? The diagnosis, how can we diagnose, and the approach and the treatment part. I think the objectives for the today's session has been touched, I think, from my side. I think all the participants who have participated in this session got some kind of learning or some kind of points which has taken back to home. I think my today's session is done. So takeaway message is this. Thank you one and all for this wonderful session.
Thank you, Dr. Gurukiran, for such a beautiful session. You have shared a lot of cases, not a single one or two, three like that, but instead different categories of cases were presented in a beautiful way. And the real homeopathy was shown in front of us, because these are the things that can make people how one can become a better homeopath rather than simply practicing homeopathy. Your intention was to prove the world that homeopathy is the purest science that can have its own methodology to find the right medicine at right time. Congratulations. Hope this kind of presentation will be there in coming months also.
Yes, sir. Yes, sir.
This is the time for discussion. Those who want to participate in discussion can raise your hand so that one by one can talk to Dr. Gurukiran. Yes, Dr. Hariharan is there. Sir, you can speak now.
Okay.
Sir, good evening, sir.
Okay, good evening, Dr. Gurukiran. Very happy to see you. Okay, I like see, really I am congratulating you for these cases. That I know you are very able to do the cure these all cases. I am sure about it. That there is no doubt. And one thing I like to say that last time I called you about the pneumonia of my wife, and you suggested the Bryonia Surabar one. But
Yes.
anyway, my wife is admitted to the Believers Medical College, and they started the high dose of antibiotic, but the dilemma is that the medicine is not responded well. Then I called you, what will be the next step? See, really, I took the case of my wife, and I found out that it is due to the suppression of the atopic dermatitis of my wife.
Oh, okay.
See, suddenly they told me, the doctors told me that the medicine is not responding. What we will do? Then I became, I puzzled, and I took the case of my wife, and I gone through the past history, and I found out that this may due to the suppression of the atopic dermatitis of his leg. So suddenly I gave her one dose of Sorina, one dose.
Okay.
In one drop in 3 doses at night. Next day, the doctor told me the medicine is responding well.
Oh, okay. Good.
That is, sir, usually, see, I like to say to the homeopathic doctors that the obstruction to cure is not only in homeopathy, but in allopathy also there is obstruction.
Yes.
So, homeopaths can do wonders regarding in case of such cases that doctor is saying that medicine is not responding and the patient is going down. Then a homeopath can use such medicines to revive the vitality of the patient, and suddenly the medicine will react and go to will go to the curing. So that is my finding, and very good. Anyway, Dr. Gurukiran, you told me that give the Bryonia 0/1.
Yes, yes.
That Bryonia 0/1 is not in my hand, but the patient, my wife became in chill, very chill. I can't, by seeing this tolerate, suddenly my daughter is there, and she carried to the medical college. So that is that was the history of that case, doctor. Anyway, Gurukiran, one case we discussed about the asthma case.
Yes, yes.
Asthma case of a patient, a child, that you told me that give laxasis. That
Yes.
laxasis done wonders, and that child has not yet this say single dose of single time of the asthmatic attack. Now child is okay. That laxasis 0/1 we started, and the patient getting well. Now it is about 6 or 8 months. Not a single time not suffered by this asthma. Okay, Gurukiran, you have a bright future. Bright future. Carry on. Doctor, thank you very much.
Thank you, sir. Thank you.
It is not only for Dr. Gurukiran, but the homeopathy has a bright future, because this kind of people are there doing the scientific work for homeopathy. Congratulations, Dr. Gurukiran, once again. And so to Dr. Manoj. I think there was some network problem with the Dr. Manoj. Is there anyone want to talk to? Please raise your hand if anyone want to have a question. Yes, Dr. Manoj is there. Okay. Please unmute, sir. Oh, please, once again. Muted once again. Okay.
Thank you, Dr. Ganesh.
Still, there is some network problem with the Dr. Manoj.
Others are not any. I like to discuss, Dr. Gurukiran, one thing. Is that your speciality? See, I found out that a speciality about your case taking is that you are not taking too much symptoms. Only 3 or symptoms rubrics you are taking. See, that is a very good sign of observation. You are keenly observing the patient, and the PQR symptoms only you are taking, and so the medicine will be very correct, and it will be a constitutional medicine also. That is why the medicine is working well. That causticum, this tarantula, say ignatia, that these are constitutional drugs. So our homeopathy we study such a way that how to find out the PQR symptoms and how to repetize it, and it will give very good result. Is it so, Gurukiran?
Yes, sir. Yes, sir. Definitely, sir. It has to be.
Now, I know Dr. Manoj is there.
Thank you, Dr. Ganesh and Dr. Gurukiran. Wonderful presentation. As always, there is no doubt about your potential. In fact, this is sketching of the portrait, as mentioned by Honeyman. Just sketching the case. With these 2 or 3 symptoms, you are doing a wonderful job. But one thing you should always be cautious that. I think once again, net is gone.
Yes. There was some technical problem. Network is always making trouble. Dr. Remadevi Ambadi, madam, you can come up, and you're, yes, Dr. Manoj.
There is no treatment for these net problems, I think. Really struggling. And
Yes, Dr. Ambadi.
am I audible, Dr. Ganesh?
Yes, now audible.
It is always disturbing. Because you are selecting the remedy, you should be very cautious about the potency, dose, rapidity.
It is making problem here again.
Yeah, I think has to be
Sorry.
given a dose of
No,
tuberculinum.
no.
Yes. This is how a homeopathy doctor need to think in that line. Whether what you find in yes, yes, somebody, madam, you are co-host. You can directly directly unmute. Let me say one second. You please unmute. Please try to unmute. You are a co-host. You can unmute, somebody, madam. Yes. Yes, somebody, madam. You can unmute now. Still there is a problem. But Dr. Gurukiran,
Yes,
now
sir.
lot of chikungunya cases are there in. It is said that there is a lot of chikungunya cases are there in Bangalore.
Oh.
What's your opinion on that, and how whether you are getting such cases?
No, sir. Here there is no chikungunya cases here, sir. We have getting lot of respiratory cases, sir. Since
Okay.
a few months, we're getting lot of respiratory cases, cough, fever, pneumonia. These kind of cases is lot of there because there is a lot of change of weather here. Winter-like season. There again, there is a cyclone since 2 days. It's raining. Again, it starts with starts with the very sunny day. Again with the winter. These are the lot of variations in the weather condition here.
Okay. Which is the medicine more suitable?
Sir, pulsatilla,
Yes, as you
weathercock.
definitely. Just like changeability and all those
Yes,
things.
yes. Pulsatilla is there. Brania is there. Arsenicum also is doing very good job.
Then, whether you are treating a lot of kid diseases along with the chronic disease also.
Yes, sir. Yes, sir. Lot of skin disease I also treat.
Okay. Anyway, it's the time to close the session. I invite Dr. Hariharan sir to say the vote of thanks to the session also.
The lottery is on me. Okay, Gurukiran, it is
Yes, sir.
I like to thank you because I got a great opportunity to congratulate you in IFPH platform. On behalf of IFPH office bearers and a lot of doctors and aspirants, a lot of and on behalf of them, I like to congratulate you. Come again, doctor. Okay. Thank you very much.
Thank you for this wonderful opportunity again and again, where I can portray my cases in this platform. Thank you, one and all. Thank you, sir.
Dr. Gurukiran has done a great job in presenting all cases with the evidence. This is what we need to do. Each of us need to do in such a way. Then only homeopathy will be reaching everywhere. And those who people are challenging against homeopathy, we can show the world that it is not so. We are doing the best scientific work for treating the patient rather than any other system of medicine. With that, thank you, Dr. Gurukiran, once again, and those who participate in the session. Tomorrow, we will have a session from Dr. Rashmi Shukla, and she will be talking about understanding and explaining futuristic homeopathy, part 3. She took already 2 sessions, and still there is a lot of things to be discussed, and she will be presenting conclude the session tomorrow. Hope all of you will be with us tomorrow at the same day. Thank you all. Good night.
Thank you, sir. Thank you very much.
It's over to Dr. Mariamma John to moderate the Malayalam session.